Hello, everyone, and I am so blessed and grateful that you are joining us today. In this interview, I have Rachael Potter. She's been a longtime friend of mine, aka a cousin, and Rachel's on the show today I sound so official, on the True Femme show, because she has a great testimony. She has been using charting for 6.5 years, and specifically NAPRO technology, or the Creighton method of charting. And so I have some questions to ask her today to just give you an understanding of how charting can really change your life and help diagnose issues that you might be facing in your own reproductive health. So Rachael, thanks for being here.
Yeah, thanks.
Rachael is due with a baby in anytime, just a couple of weeks. So we are just so blessed that she's here to join us. So thanks, Rach.
Yeah.
So first off, like I said, you've been charting for 6.5 years using Creighton. So before then, tell us a little bit about your history and what made you feel like something was off, right? That got you started with charting.
Yeah. So I would say I didn't in middle school, and once I started my cycles, my mom kind of always encouraged me to just chart just to have an idea. And at that point, I was just like, I'm not doing that. Like, I was in 7th grade and it just wasn't, something that intrigued me or I saw a reason for. And so I didn't really start paying any attention or anything like that. But about 10th grade, I started having some health issues and just extreme hair loss and PMS and just fatigue and headaches. And I didn't really know at the time why, but it was, I think now looking back, it was definitely related to that. I do have some thyroid issues as well, but once I started charting later on, I realized that a lot of the stuff was tied to my cycle. And I remember going with my mom to multiple doctors trying to figure out what was going on, and everything that was offered was birth control, and that was it. And I would say about 5 or 6 doctors in, I was just like, I give up, I'm done. I'm so tired of hearing about birth control, and that's not what I want to do. And then during that time, I was just kind of, I wasn't dating anyone, but open to that. Obviously, I'm kind of looking for somebody if that was my calling for my vocation. So when I was about almost 20, I met my husband. And at the time I was having a lot of health issues, but I did finally find a naturopath that helped me with some of my thyroid stuff, but I was experiencing other symptoms as well. But when I met my husband, I was still going through those things, but then I kind of put it on the back burner. And then we dated for about 4 or 5 months, and then he proposed, and we got engaged, or married the following year. But once we were engaged, I knew it was important to chart just for family planning purposes. My husband hadn't even heard of NFP or had no idea what that even was, but was very open to it. And he just said he didn't have any other reason why we'd do something else. So he was very supportive from the get-go. But I just told him that I had experienced a lot of symptoms and had seen a lot of doctors, spent a lot of time and money invested in that stuff, and nothing was really going anywhere or ever went anywhere. And so that I was wanting to look into something further. And my mom had suggested Pope Paul VI. So we first started, I guess I'll stop there with that question, just as far as that's kind of the symptoms I was experiencing. It was like PMS, excessive hair growth in unwanted areas, hair loss, fatigue, and even some depression at times. And so that's kind of what triggered me to dig deeper.
Yeah. So that kind of leads into, I think, a medical question. And that is, when you started charting, what kind of patterns were you seeing in your charting? And what was the diagnosis you received and the process of getting that diagnosis?
Yeah, we started charting I would say about 6 months before we got married. And originally we started with the symptothermal because it was just one I heard about more, and it seemed like we just picked that one randomly, I guess, really. Um, so we started with that, and I was kind of overwhelmed with it, and I was kind of struggling with charting it and figuring that out. And I think a lot of it was just because of my symptoms. Everything was so irregular that it wasn't really the method for me. And so at the time, though, I had just done basically taking my temperature for about a month and a half, and then met with a friend of my mom's that was a NAPRO trained, or a Creighton trained nurse. And so she said, why don't you just do that for a little bit, and then we'll just take a look at that. And so I showed her that after about a month and a half, and just from my temperatures alone, in the chart that she gave me, she was like, I can tell something's totally off here. And so she's the one that suggested Creighton. And so we actually ended up working with her. She was our teacher. And that was the best thing that could have happened. It was definitely the method that we needed. It was more precise and helped us see things more clearly. So I was even seeing before and after my period of brown, black bleeding. And I was seeing like where my PMS would start, and that I was having a period almost every month, but they were really not within like those few days that you're supposed to be. It was so that they were considering me irregular. And so kind of lost my train of thought, but so can you just repeat the question? I just want to make sure I'm
it sounds like, like you kind of touched on it, like some of the abnormalities that you had seen because you started paying attention to your cycles, right? Irregular cycles, irregular periods are not normal. And a lot of people like have been told, oh, it's fine. We'll put you on the pill to regulate your period.
Yeah.
It actually isn't a real period that you have when you're on the pill. That's beside the point. The other thing I want to touch on for anybody who's watching this video who's not familiar with charting methods is you touched on the fact that you had used symptothermal and Creighton. And there's different types of methods that utilize different markers that your body can communicate. And symptothermal uses, I believe, cervical mucus and temperature in a different way. But Creighton uses primarily cervical mucus, and it's much more standardized and nitpicky about what your observations are. But that obviously leads to really good data and good diagnosis of issues. Mm-hmm. So tell us a little bit about being diagnosed, how that worked out, like after a physician looked at your chart with a NAPRO physician, what happened from there?
Yeah, so I contacted Pope Paul. I didn't really even know where to start. I just called them and happened to talk to a receptionist, I think, and just said that I was experiencing all these things, and that I was looking to get married, and that I've been having these symptoms for a while. Actually, I think we were just married. But I knew at that point, because I had been charting for a couple of months with this trained woman that I was like, I know something's wrong. So I called them and just kind of explained our story a little bit and what I was looking for, and that I wasn't having luck in my area. And immediately they were just so loving and caring and just like, oh, absolutely. Like we're so glad you reached out, and you're exactly who we're here to help, and we can definitely help you. And so they've forwarded me on to someone that kind of helped me organize what they needed in order to diagnose me. And so I had an ultrasound done. I had a few done prior, but I had another one done for them, some lab work, and they wanted all my charting submitted and then all my health history. And so they were able to look at all of that. And when they looked through it, they wrote back saying that I'm definitely a strong candidate for someone to come over there and have a diagnostic surgery done. That my charting was very strong for PCOS and endometriosis. They didn't know the severity or anything like that, or necessarily even other things going on, but that was the main diagnosis, was PCOS, endometriosis, and probably some hormone imbalance. So that was like my diagnosis through everything that I'd submitted. And they wanted to just do the diagnostic to see what exactly was going on.
And just for listeners, two things: the clinic that you're referencing is the training center for NAPRO physicians. So that's in Omaha, Nebraska, and it's called Pope Paul VI, right?
Yeah.
I was like, I'm pretty sure that was the right Pope. Yeah.
Yeah.
And the other thing to just point out to listeners, that endometriosis is a speculative disorder until it's diagnosed with a surgical exploration. And so that's obviously what prompted your visit there for a surgical exploration. Surgery to some people sounds like a scary word. Can you talk a little bit about what that was like, and what it was like working with a trained physician in restorative reproductive medicine, which is what we're talking about?
Yeah, we had an amazing experience. I mean, thinking about going back there and all that, I wasn't too intimidated. We were just kind of just ready to go, because it was like, we're done wasting time here and not having answers. And so we were really looking forward to going, and then we love to travel. So it was an opportunity to travel. And so we went over there, and really as soon as we got there, it was just so welcoming, just very caring, very just positive about women's health. Like they just, I felt like, and doctors I had seen previously, it was just kind of, the compassion wasn't there. And it was just kind of, okay, these are your symptoms. Here's birth control. That's our solution. That's what is going to work for you. And there's just not much, I just didn't feel like there was a lot of compassion. But with Pope Paul VI, instantly, just my husband and I both just felt so comfortable, and we're like, this is the place we were supposed to be. And so working with them was incredible. They really explained things to us. They took the time to look through our charting with us, explained what they're seeing in the charting, why they said that, or why they were giving that pre-diagnosis of endometriosis and PCOS, like the signs in the charting that kind of give them that clue. And it was just really amazing to hear how just something as simple as a chart can give so much information. And it was really empowering for us to have that. And even surgery, I personally don't have a fear with being put under or anything like that, but I still had a fear of, what are they going to find, and what are we going to be dealing with, and what kind of effect is this going to have on our future, especially with family. And so that was more my fear than surgery itself. And so they're very reassuring, and just saying, this is diagnostic. We're just going to see what we're dealing with, and then we'll come up with a good plan that we feel is the best for you, and work with you guys to see what you feel is best too. And so we were 100% on board, and had the surgery. And it was, I think for me, the hardest part after surgery was just the fact that we knew we had to come back again. And I was thinking, oh, it's probably going to be something very minor that they can probably just take care of while they're in there. And it didn't end up being that way. I had an expectation, but that was the harder part for me, I think, is just the timing of everything. We were ready to start family, and we thought it was going to just be kind of like an in and out, you're good to go. But they really explained things to us, and they even did a video and everything, and showed us everything they saw inside when they were doing the surgery. And it was just a really good learning experience for both my husband and I. And so we actually enjoyed that process. And I ended up having an adhesion on one of my ovaries as well. And so that was causing some pain and issues as well. But they were just very encouraging. They're just saying that I had ended up being diagnosed with endometriosis, but it was they said it was more of a mild endometriosis case. and then, yeah, the adhesion and PCOS. And so they had suggested to remove all the endometriosis, have an ovarian wedge resection on both sides, and remove the adhesion. So that was what ended up being my diagnosis. And then we went back. We went for the diagnostic in March, and we went back at the end of August for the second surgery to have all that done.
So for our listeners, I want to call out a couple points and just emphasize them and what you're saying. Number one, if you had gone to a traditional OB, you probably would have been put on birth control. And then they would have probably said, just stop taking it when you're ready to try. And if you're unsuccessful getting pregnant after a year, come see us. That's pretty typical, right? And I've worked with women, and your story is really encouraging, and I think women should be encouraged, but I have also worked with women who were put on birth control for very similar symptoms that you're describing, and we're on it for 10 years, all the while, if there is something wrong, that disease is progressing, right? It's not being treated.
Yeah.
And so one of the, I think, huge benefits of charting is that you are getting all of these clues assembled so that you can expedite treatment, not only just for fertility concerns, but for your health, right? Because I'm sure, and you could probably support this, that once you had that surgery and got your hormones under control, under the supervision of a NAPRO physician, I'm sure you feel 100% better than you did before, right? It's like life-changing transformation because of that intervention. And then the second point I want to bring up is that not all surgeons are the same, right? There are many OB surgeons that do wedge resections and they cut out endometrial tissue and whatnot. But the difference with a restorative reproductive physician and surgeon is that they're highly trained to do fertility sparing surgery. So they are meticulous. It's not a hack job. They go in and they're very, very meticulous at what they're doing to preserve as much fertility capability as possible. And so again, with the clients that I work with, if surgery is looking like that's the road that they might go down, I am very territorial and picky for them about which surgeons they're allowed to see. Because again, if we're maximizing fertility, that's the goal. And to, a woman who's a fertile woman is a woman who's healthy. And so preserving that fertility is the goal. So thank you for sharing that. Is there anything else you want to add about your experience there?
Yeah, just to add on to that, Sarah, what you were saying is so true, because when we went there, I wasn't on birth control. I'd never been, and I hadn't had any surgeries done yet, but they said that I was a very unique patient, because most of the time, women that come to them have been on birth control or have already had previous surgeries done. And they just said that a lot of times they see more issues because the surgery was done incorrectly. And there's a lot of scar tissue or things that they actually have to go in and try and repair from previous surgeries. Because like you said, Sarah, like it's almost more of like a hack job in a sense. They're just not very precise. They just kind of go in and do what they think and get it over with. And so he just kept saying, like, it's pretty unique to see a patient like you that hasn't had any surgeries or no scar tissue or anything. And so that was just, I guess for me, I was just like, I always tell people, if you think you need surgery, just go straight to Pope Paul or a NAPRO doctor, because I said, you won't be disappointed. And I would hate for people to be disappointed because they tried other solutions just because it was easier in their area or whatever. But it's so worth going that direction because they're going to do it. And so,
especially for the rest of your life, right? And I think that's the thing, is people, sometimes I have encountered women that are afraid to chart because they're afraid to know if something's wrong. But the reality is like, if something's wrong, you don't even know what it feels like to have something be right, And so getting to the root cause is absolutely essential to optimize your health in all those different areas, which is so cool. And I'll just tell people who are listening that if you have questions for Rachael about this, please put it in the comments and I'll make sure we get answers to that, and questions about any of the resources that we're talking about. I'll be happy to link to those in the comments if you would like them. there's a lot here to unpack about endometriosis and PCOS, and those are all topics that we'll eventually cover in this group, and give you some good sources of information and evidence-based research about those topics. But obviously, in our talk with Rachael, you can see that early diagnosis through charting, being able to collect data on yourself and then work with a provider who's trained to interpret it and then treat based off of your own body is great women's healthcare, right?
Mhm.
Going to the
Yeah.
doctor and having one solution for all of your problems is terrible healthcare. It really is.
Yeah.
So again, kind of rings true to the fact that we have to elevate ourselves as women by advocating for full informed knowledge of our healthcare options. So Rachael, I'm just going to ask one more question, and so that we can not, I could talk to you for like 3 hours, but that would be a really big video to upload to Facebook. So I want to ask one question is, what piece of advice would you give to listeners listening to this video about, you know, what you've learned through your health journey? What would you advise them if you were talking with somebody who was questioning it?
Yeah, I just always tell people that, you know, in today's society, especially, I feel like women are just, we're just so looked down upon as far as like our fertility and our beauty and how our bodies work. It's looked at as an inconvenience, and just kind of a lot of work. And so I always tell people to really try and change your mindset about who we are as women and who God created us to be, because it's really a beautiful thing. Fertility is a beautiful thing. Even if you, you know, even if you're not looking to start a family, even just in young girls, it's just so empowering to know your body. And it's really not inconvenient once you understand it. It's actually more peaceful. And so I just tell people, you know, to really try and tell yourself the opposite of what we're told, because a lot of times we're growing up, you're just, you know, it's looked at as annoying that you have a period or that you have these symptoms, or that it's normal to have these symptoms. Everybody has painful periods and irregular periods, and that's just, you're just the normal group of women. But it's really not. And so I just tell people, or encourage them to really look into things, dive deeper, and don't just accept the answer that you don't want. You know, I mean, I think like Sarah's saying, it's just pretty much this, exactly what you said, is that you go in, they tell you birth control is your answer, go off of it when you're ready to get pregnant. And if after a year doesn't work, then we can look at usually in vitro. And that's really not the solution. It's just dive deeper into like find the solution that you want, I guess. Look for that answer and don't stop searching for it, because it is out there. And I just really always encourage people to just go straight to politics or a napro doctor. Start with Creighton, because I think it's just going to cut off a lot of time of anxiety, fears, just wondering what is going on, and discouragement. And that's something I wish for myself that I would have done. I wish I would have charted in 7th grade when my mom told me to, because it would have
well, that's why I'm teaching teens, right? You know, so Rachael, that there's so many gold gems there. And one of the things I just want to tell listeners is that like Rachel's explaining, we have the Creighton method. I teach the FEM method. There's different methods, but at the end of the day, the most important thing is to just get started charting. Especially, if you're a woman who's experiencing infertility, and that might be the main reason, or just simply if you're somebody who has, like, your life is ruled by your periods. When your period comes, it shuts your life down. That's not normal. And you shouldn't have to put up with that. There's ways to alleviate that. And also, again, like across the lifespan from puberty all the way to menopause, like women will have challenges with our bodies and our hormones, but those things can be treated. And so the first step to the treatment is understanding what's going on, right? I also tell people, if you have a beautiful looking chart and it's totally normal, yay, right? Like, good for you. That's so exciting. But that could change throughout your life. So if you just continue to chart and keep data, you will be able to recognize those changes and then get help before something's too far, like you're so
Yeah.
overwhelmed by those issues. And so
Yeah.
anyway, Rachel, I could talk to you for 3 hours. I have like 100 more
I know.
questions, but we'll stop recording and then you and I will keep talking about it. But again, if anybody has questions about anything we talked about, charting, all of that stuff, please write in the comments and I'll be happy to provide some context. So again, Rachel, thanks again. And your story is powerful. So thank you.
Yeah, thank you for having me.
Right.